All right, so we're going to be doing the ciprofloxacin IV piggyback for Millie Larson. I am looking at her medication administration record first, and I have Millie Larson, date of birth 1/1/1936, no known drug allergies. We're giving ciprofloxacin 200 milligrams per 50 milliliters of 0.9% sodium chloride. IV piggyback, we're running over 30 minutes. The drop factor is 15 drops per milliliter, so that's going to make the drip rate around 16 drips per minute. We're giving this for a urinary tract infection. As we said, she has no allergies, so we're going to do our hand hygiene, and we're going to make sure that we have everything we need. We have gloves, medication, the lining for the secondary tube lining. I have my primary line already started, and my medication administration record here. We already provided privacy by closing the curtain, and now we are just going to check the bag that we're giving to make sure that it lines up with the MAR. So we have on the medication administration record, ciprofloxacin 200 milligrams per 50 milliliters of 0.9% sodium chloride, and I have ciprofloxacin 200 milligrams and 50 milliliters of 0.9% sodium chloride. So that matches up. I am going to remove the outer bag and use a aseptic technique. I will check again for integrity of the bag. No issues with that. The expiration date is January 2023, and we are looking again. We have ciprofloxacin 200 milligrams and 50 milliliters of 0.9% sodium chloride. And the bag is ciprofloxacin 200 milligrams and 50 milliliters of 0.9% sodium chloride. We're giving this intravenously through the intravenous piggyback. I am going to perform hand hygiene. Identify my client. 2 forms of identity verification. So I am going to use her name on our medication administration record, Millie Larson. Bracelet says Millie Larson, and we're going to do her date of birth on her MAR, says 1/1/1936. Date of birth on her bracelet is 1/1/1936. So that matches up perfectly. I am going to open up my bag of tubing. We're going to maintain aseptic technique doing so. That's the hook that I'm going to be using to lower the primary bag. All right, I want to close the roller clamp here. So the clamp is closed. We are going to remove the cap on here. So remove the spike cap, not touching the spike. Insert the spike into the bag. All right, and we're going to hang the secondary bag like so. We want to make sure that the primary bag hangs lower than the secondary bag. Okay, so I have the lines lining up. The secondary bag is higher than the primary, and I'm going to squeeze the drop chamber to make sure that it is halfway full, which it is. Our clamp is still closed, and I'm going to prime this line, opening up our clamp, making sure that the fluid comes completely through the line with no air bubbles, and we don't want it to come out of the end of the line. All right, so we have it going all the way through. I'm going to reclamp it and check for any air bubbles. If there were air bubbles, I would flip the line like so until they get all the way up into the drop chamber. Okay, and perfect. All right, now I want to take the line, perform hand hygiene. Put clean gloves on. We're going to assess our IV site of our patient, Millie. All right, so we are assessing and palpating the IV site. IV site looks clean, dry, no signs of infection. Millie, are you having any pain or issues with your IV site? Millie says no. We're going to take our gloves off. Hand hygiene. All right, I want to now ensure that the clamp of the primary line is closed. Primary line clamp closed. It's not going anywhere. We are going to take the secondary line and an alcohol pad. And get the alcohol pad out. All right, I'm going to remove the cap off the end of here. And I am going to scrub the primary line port vigorously, making sure I'm not touching either. I'm going to attach the secondary line to the primary port, as so. And I'm going to move my primary bag back up, and so. And then I want to make sure that I have my clamp open on the primary line, as we want to set the drip rate, which we want to be about. So we have about 16 drips per minute. I'm gonna get my clock going. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. All right, so I'm going a little bit fast. I'm going to adjust my rate. And I'm going to restart counting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, and we're at a minute, so that is correct. All right, now I want to put some gloves on, recheck the IV site on my patient. So I am palpating and assessing. Everything looks good. Lily, are you having any pain where your IV site is? No? Okay, perfect. Glove off. Hand hygiene. And I am now going to sign my mark. And that is it for the piggyback